everyone, welcome back. Today, I want to talk about something that causes a lot of confusion for patients and families. And that is this question: what other services can you receive while you're receiving palliative care? Palliative care is designed to complement other medical treatments. It does not replace them, and it does not interfere with them. Palliative care can start at any stage of serious illness. Its purpose is to help manage symptoms, support decision-making, and improve quality of life, while other treatments continue. If you're already seeing a specialist, that does not change. You can continue care with your oncologist, your cardiologist, your neurologist, or any other specialty doctor involved in your care. You can still go to the hospital. You can still go to the clinic appointments. You can still receive treatments that are meant to treat or slow down the illness you are dealing with. Nothing needs to stop just because palliative care is added. Patients can also continue receiving supportive services such as medications, physical therapy, occupational therapy, speech therapy, home health services, and rehab services. All of these services can happen at the same time as palliative care. If someone tells you that you must stop the aggressive treatments or life-prolonging treatments in order to receive palliative care, they are respectfully wrong. I say this because I have seen patients and families become confused or scared after being given incorrect information. Palliative care does not require you to give up your treatment. This confusion often comes from mixing up palliative care with hospice care. Hospice care is different. Hospice is considered when all curative treatment options have been exhausted. Life expectancy is generally 6 months or less, and comfort-focused care becomes the main goal. At that point, aggressive or life-prolonging treatments are stopped, and hospice service begins. But that is not the case here with palliative care. At this stage, you're still fighting. You are still treating the illness, and palliative care is there to support you through that journey. Think of palliative care as an extra layer of support. It focuses on the patient, the family, the caregiver, and works closely with the primary care doctor and the specialist, all with one goal in mind: improving quality of life while medical treatment continues. Palliative care does not interfere with any other services you're receiving. It simply becomes part of the team. So in our next episode, we'll talk about who is part of palliative care team and what each role looks like. If this episode helped clarify things for you or your family, feel free to share it with someone who may need it. Thank you for being here. I'll see you in the next episode.